also spoke with Senator Matt Klein for his perspective.
You are a hospital physician and you are treating patients with COVID-19, and you are also a member of the legislature. What do you want Minnesotans to know?
You know, the biggest thing, Shannon, is you hear a lot of us physicians complaining about how we don't have testing. And there's a couple of reasons for that. Not only that we can reassure our patients and give them a diagnosis one way or the other, whether they have COVID-19, but also as we try to work to get Minnesota back to work, having testing and knowing where our cases are is going to be essential to part of that strategy. So if we know exactly where there's an outburst of cases and where it's spreading, and we can get in touch with those people and their contacts, we can be much more strategic about shutdowns. Right now, because we don't have testing, we have these blanket shutdowns, which are having the devastating impacts that you're aware of. So I do want people to know that as Governor Walz works, and I think he's doing a great job to expand testing in Minnesota, that's going to open up a lot of doors for us, both as health professionals and as legislators.
Now, I read just in the paper this morning, though, that there is an unknown number of people who are asymptomatic but are carrying COVID-19. How does that factor in?
It's true, and that's why we're telling people at this time to sort of wear masks to the supermarket and obviously practice social distancing. Minnesotans have been extraordinarily adept at that, and that's great. But again, even if we have sort of universal testing, that we can figure out where sort of hot spots are, and we can even be more tactical about those types of behaviors. So you're right. It's a problem that there are asymptomatic carriers walking around. Somebody who looks perfectly healthy may actually be carrying the disease. So that's why this has been a particular challenge.
Now, as you know, Governor Walz's shelter-in-place order was meant to flatten the curve, to slow the rate of infection, and also to buy time. One of the consequences of that has been record unemployment and a slowing of the economy. So, as a lawmaker, how do you weigh that tension between the economy and public health?
Well, this is what has been inspiring, is that except with some exceptions, this has not been a partisan issue. I think Minnesotans from both parties realize that while the virus is a tremendous threat to our public health, economic devastation is also a threat to the health of Minnesota. And we need to find a pathway to reconcile those two things and do the right thing. And Governor Walz, today is going to put out a plan for how to get Minnesota back to work. I think he's thinking about that very strategically. Sort of the universal stay-at-home blanket shutdown order that he had originally was necessary to slow the progress down of this disease and to give us some time to build up our capacity at the hospital. Now, as we move the economy back to starting, we're going to have to implement safe practices and find certain industries that are more ready than others. But we do have to get Minnesota back to work because we can't ruin our economy here in this state.
Senator Klein, I want to thank you for your service to the health of Minnesotans, and I want to thank you for your time today.
Thank you, Shannon. Thank you for your good work in this difficult time.